Okay, so after completing my independent double check, I'm now going to dispose, or I'm going to put my medication away. Okay, and I'm going to verbalize hand hygiene before I walk into my patient's room. I'm going to bring my identifier or my worksheet, and I'm going to bring my syringe in with me. Okay, I'm going to walk into another room. I'm going to place it on the side table here. Okay, so I'm going to verbalize my environmental check. I want to make sure that the bed is at my working height. The brakes are on the bed. I'm going to make sure that the railings are up on the sides, and I'm going to make sure the air, oxygen, and vacuum are working. Okay, and I'm now going to introduce myself. So hi, my name is Sarah. I'm a Durham College nursing student, and I'm going to be injecting you today with enoxaparin. Is that okay with you? Okay, perfect. Okay, so before we get started, I'm gonna just complete my identifiers before we get going. Okay, so I'm going to use his wristband. I'm gonna use his wristband. And on my worksheet, okay, can you tell me what your name is? Sid Garland. Okay, it says here Sid Garland, and on his wristband it says Sid Garland. Okay, and then the medical number is 344316. It says here 344316. Can you tell me what your date of birth is? Okay, so he says that's November 8th, 1965. It says here November 8th, 1965. Okay, and okay, can you tell me what your allergies are? Okay, penicillin and codeine. Okay, and it says here penicillin and codeine. Okay, so before we get going, can you just tell me like what kind of reactions you get with the if you do have an allergic reaction to penicillin and codeine? Okay, thank you. Okay, so I'm now going to describe and I'm on a landmark as well. So I'm going to be landmarking on the abdomen. I'm going to be doing it 2 inches above the umbilicus. Okay, and I'm going to make sure, I'm going to assess the abdomen. I'm going to make sure there's no signs of nodules and there's no inflammation, no edema, no ecchymosis present. I'm going to palpate the area to feel for any tenderness. I don't feel any, so I know that the site is ready to go. I'm going to immediately don on my gloves. Okay, I'm now going to open my swab packet. Okay, and I'm going to clean the area 2 inches outward. Okay. Okay, so I'm now going to allow the area to dry before I get started. Okay, and I'm now going to grab my syringe here. I'm going to uncap. I'm holding it like a pencil as well. So I'm holding like a pencil in my dominant hand, and with my non-dominant hand, I'm going to pinch the area. I'm going to hold the pinch, and I'm going to be inserting this at a 90-degree angle. We are able to do it at 45 degrees to 90 degrees, but I've chosen to do it at a 90-degree angle. Okay, and I'm going to quickly insert my needle, sorry. Okay, I will not be aspirating for any blood. And I'm now going to slowly administer the medication. As I still hold the pinch, I'm going to pull out the needle. Okay, with holding my pinch, and now I'm going to let go of my fold. Okay, I will not be massaging the area at all. I'm now going to properly dispose of all my equipment. Okay, I'm going to put my sharps in the sharp container. I'm going to put all my trash into the trash bin. I'm going to now remove my gloves. Okay, and I'm going to put my gloves into the disposable as well. Okay, before I leave the room, I'm now going to complete 2 health teachings. Okay, so I would tell the patient to report any signs of bleeding, and they should use a soft bristle toothbrush, and be careful of stubbing their toes at all because we do not want them bleeding. Okay, and now I'm going to complete my post-assessment. I would have verbalized, that I would have come back into the room about 30 minutes to an hour later to assess my patient to see if they've had any allergic reaction to the medication. Okay, and now I'm going to properly sign my MAR. Okay, so now after signing my MAR, I'm going to get my co-nurse or my preceptor to co-sign my MAR to make sure I did it properly. Okay, thank you.